What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering the emergency room X-ray tech. The art of creative thinking to get the best images, right? So to give you context, I am a night shift X-ray tech, work in the ER and all the hospital, and also I dabbled in the day shift because of overtime. I would say out of all the departments, out of the emergency room, out of the patient outbuilding, out of the main radiology, out of the tiny urgent clinic, whatever we have, the emergency room is the land of the creative arts of do what you got to do to get the most optimal picture, because your patients will come in what I call is the GTA hospital situation, because you don't know what's going to come in because of what they were doing out there, and they will come in sometimes not the most optimal or easiest of patients. Let's say a patient's foot is broken, or they can't place the foot down all the way, because usually for a regular foot, you have the patient bend their leg, place the foot down, and then kind of turn it, and then lateral. Okay? That's an ideal world. Sometimes because of America, or other times because of arthritis, other times because it hurted it, or other times because they can't maneuver. You can't always have the patient bend their knees and just... Sometimes it all depends if you're by yourself or you're with another tech. So if you're by yourself, you'll have to sometimes get the board. Let me give you context. You'll have to get the board and then grab a box. And to be honest, anything in the emergency room is fair game to hold up your stuff. All right? Anything is fair game. Via towels, via the cleaning device, via a box of gloves, via whatever you got to do to hold your box, your little thing, to prop it up. Chairs, wheelchair, whatever you got to do, bro. And then you just prop it. And then depending, like for a foot, usually will angle 10 degrees. So if the board's already propped a certain way, you'll just probably either just shoot it straight down or have to compensate the angle to get it. It gets the job done. It looks the same. There's ways around it. Or if there's two techs and you don't have anything, you'll just have to hold the board to compensate for the angle. You can do it like that. I've seen everything from Kleenexes, boxes, from the patient having to hold their own stuff, from the cleaning wipes, from a wheelchair, from the slide rail, from the table that people eat their food off of, from like, what else? Gowns, from, what else have we used? We've, blankets, pillows, neck pillows, backpacks. What else? We've like literally anything that can hold prop board. You will get into the art of creative thinking to get the job done. Like you, because your patients will come at you and they'll show up in the not the most optimal ways, and you'll have to kind of think, because sometimes the patient can't place the board down, so you have to shoot it up or shoot it, like you have to think. It makes your creative thinking of like it's wild, because sometimes, like let's say for instance, there's a forearm. The patient can't fully extend their arm and rotate it to get the full AP. So sometimes the patient will have to put their arm down. So essentially what happens is this part will be, once again, PA, but the elbow will be kind of lateral. So it kind of looks like you have one and one, and then you'll have to cross table it to get the other view, which will prop it for this part to be lateral, but this one to be like AP. It's weird. Sometimes you just have to put in the notes that this is the best you could, or we did multiple attempts. There's sometimes where the patient will be so messed up. I've done it one time where a foot came in Usually, your foot's like, sits like that. Nah, this homeboy's foot was facing down. So like his leg was straight, but his foot was like the other way down. So like I was not prepared for that. It blew my mind. I did not know what to do. I just took so many pictures because I'm like, okay, so we're just gonna get both laterals, internal and external, and then we're gonna shoot it down like a tib fib, and then we're gonna shoot it up. Like we did so many views, and we documented, hey, like we got all the pictures we could because like his foot is like really bad, and like we didn't know how to do. Like even the doctor was like, "This is pretty impressive. It's still broken. It's still whatever, but like." Sometimes you're only going to get 1 or 2 views because of how messed up the patient are. And that's the beauty. That either comes with time or with veteran techs. Because if you don't know what to do and you're just looking at it and you're like... kind of makes your patient nervous. But like even if the patient's messed up and you already know, you're like, okay, this is what we're gonna do, and it's just smooth guiding. You're just like da 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 da. Sometimes you just have to angle the tube, and then you just have to play with the angle, and it will kind of get the job done. Sometimes you surprise yourself. You shoot it, you're like, damn, that looks better than my normal wide view or your normal whatever. Sometimes it is what it is. Yeah, it's been your boy Miguel. Hope you enjoyed this knowledge, giving you the game, the sauce, or whatever you want to call it. Giving back to the community because out of all the departments, we are the godfathers, the bottom tier. No one likes us. If you go on the internet and you put anything for nurses, there's so many videos, but no one does it for Xray. So I will be your messiah, giving you the guide of all aspects of radiologies. There's videos to come for my first to like 2025. I have a video posting almost every single day, which different niches and like literally any aspect of radiology that your little brain will come up with. I've probably already thought it and I have a niche little topic because when I was an X-ray student as a young lad, I was like, hey, what do we do if blank and blank? Go on the YouTube. No one would talk about it. Or they had a video from like the early 2000s, people doing film, and I'm like, that's not going to help me. So I'm here giving you the guide of the knowledge for various aspects of radiology. From the most niche thing to the more broad, common things. And I do this to give back to the community because I wish when I was a student someone would do this for me. Yeah, it's been your boy Miguel. See you on the next one.